In today's video, we'll cover cleft lip and cleft palate. This is a very important question which usually comes. So first of all, addressing the what is a cleft lip. So a cleft lip is a birth defect that results in a unilateral or a bilateral opening in the upper lip, mouth, and nose. Now, basically, the reason why a cleft lip occurs is because of the abnormal development of the median nasal process and the maxillary process. Median nasal process and maxillary process. Now, you must be knowing what is median and maxillary if in case you don't know. So, suppose this is the diagram. Okay, now over here, what you will see is this still here, it is median nasal process. This is lateral nasal process. From here, eye is formed. This entire portion is the maxillary process. So the abnormal development of the median nasal process and the maxillary nasal process. This is the frontonasal process. Okay, and this is the mandibular process. Now coming on to cleft palate. Now in cleft palate, it is also a birth defect. Now it is characterized by an opening, birth defect, opening in roof of mouth due to lack of tissue development. Now, why is this occurring? This is occurring due to the incomplete or the failure of fusion of two palatal processes. Now, to understand this, you can understand from here. This same thing. So, this is the frontonasal process. This is the pre-maxilla. Okay, and this is our maxillary process. Now, if I cut it, it will happen to be like this. So, this will form the nasal septum, frontonasal process, and this is the nasal cavity. This is the maxillary process. Now, this further develops into two palatine processes. Okay, these are the two palatal processes. Now, due to their failure of fusion, what we have is cleft palate. Now, there are many theories also that tell us about the formation of cleft lip and cleft palate, but they are not they are discarded and they are not universally accepted. This is just for an extra information. First one is Darcy Yes. Now, he told us that the theory is basically due to the failure of fusion of certain processes, but it is no longer in popularity. And the second one is related to the mesoderm. Now, what happens is it was given by Fleischmann. Now, he stated that there is the arrest of disappearance of the epithelium membrane. Because of that, the epithelium remains intact. Now, it is not being penetrated by the adjacent mesoderm. So, there is not enough mesoderm that migrates to the specific area which is responsible for the formation of a groove. If the mesoderm had come here, the groove would not have been formed. However, this is not a universally accepted theory, but it is sometimes asked in questions. So I mentioned it. Now coming on to if you want to know the more of it, so we can say that we will have the this will become the median part of upper lip. Now here will be the palatal processes. All right, and this is the position of nasal septum. This is the pre-maxilla. Now this will further convert into, so this is our frontonasal process which forms premaxilla, and this is the soft palate and this is the hard palate. Okay, now coming on to the incidence, a lot of questions come from incidence. So first of all, it is a very commonly rare condition. It occurs in 1 in 600 live births. So for isolated cleft palate, it is 1 in 1000. It is more common in oriental groups is 1 is to 500. In blacks, it is 1 is to 2000. Highest incidence is seen in Native Americans. Now, for cleft lip, you remember that it is more in males, and cleft palate is more in females. Now, think of it like females love to talk, so palate will be more in females. Now, this will be 15%. This will be 40%, and if cleft palate and cleft lip are occurring together, it will be 45%. Okay, also remember that the cleft lip, right? So the unilateral cleft lip, the left side is more has more occurrence. Okay, now coming on to the etiology, what really causes a cleft lip or cleft palate to occur? So in etiology, first of all, we will see that there will be some genetic factors, nutritional factors or nutritional disturbance during development. Environmental factors are also an important etiological cause, like infection, thalidomide, which is teratogenic. Uh, if you remember, it causes seal-like limbs, so it leads to phocomelia. Okay, then infection, thalidomide. Then there can be radiations in the environment. Also, if there are anti-epileptic drugs, if the mother is taking anti-epileptic drugs, now there can also be defective vascular supply due to which there is not a proper development. Okay, then also the maternal consumption of alcohol and smoking, maternal consumption of alcohol and smoking. Okay, now there is one more physiological, emotional, traumatic stress. Also, if there is mechanical stress, now mechanical stress is basically mechanical disturbance. Suppose if the size of the tongue is large, so it will prevent the union of the parts. Okay, now coming on to the predisposing factors. In predisposing factors, if the mother is of high age, high maternal age, if there is diabetes mellitus, toxemia, there is a decreased blood supply, if there is fatty acid deficiency, also if there is radiation. Okay. Now coming on to the next, which is the types. Now in types, first one is central, then lateral, then complete, incomplete, then simple and compound. Now in compound, what we see is cleft palate and cleft lip are happening together. In this, it extends to the floor of the mouth, extends to floor of mouth. Incomplete does not extend. Now lateral is the most commonest. What we see is that there is the cleft which is present between frenum and the lateral part of the upper lip. Okay, lateral part of upper lip. Now if I have to show you by a diagram, so basically this. Okay, then coming on to the central. The central is quite rare, and it is a rare condition. It is also called as hair lip. Okay, hair is an animal. Okay, uh, rabbit like but taller than that. Now this is a normal lip. Okay, now what you'll see is, suppose this is the nose. Okay, and what you'll see is, you'll see something like this is central. Okay, now coming on to the cleft palate. In cleft palate there are two types, one is complete and another one is incomplete. Now in incomplete we have bifid uvula, whole length of soft palate, it is bifid, then whole length of soft palate and hard palate. Now incomplete, basically there is no fusion of the palatal processes. Okay, so you can write that here. Now coming on to the classifications, this is also very important, a lot of questions come. I'll tell you about two. So first one is views. In this they divided them into four groups. Okay, now coming on to the first one. In first one, what we'll see is, we'll see only soft palate. In the second one, we will see soft palate, hard palate. Now the soft palate will be till incisive foramen. In this complete unilateral, cleft of soft palate, hard palate, but on one side. Okay. In group 4, we have complete cleft, bilateral, soft palate and hard palate, plus alveolar ridge also in this lip also on the both sides. Okay. Now coming on to this Lashal's classification. This is a very interesting and very easy to learn and easy to decipher classification. So in this, what happens is you need to remember this thing to remember this classification. Okay. Now hard palate, soft palate. Okay. Now this is the point where it meets is incisive foramen. Now understand. First of all, the capital letters, okay, they will stand for complete cleft or the complete type, and the small letters will depict incomplete. Okay. Now suppose, okay, now L stands for lip, A stands for alveolus, H stands for hard palate, S stands for soft palate. Now suppose if we have a person with this Lashal. Okay. Now what you see is capital letters. So complete. Both the sides there are capital letters. So bilateral. Cleft, palate, and lip. This was easy. But now another one. Lahsh. Okay. The S is bigger. Okay. Now this is incomplete, right? So the right side it is incomplete. Right. Unilateral. Cleft. Lip. Okay. L is small. Then complete cleft of soft palate extending till hard palate. Okay, did you understand? um, I'll tell you again. So L is small, incomplete, right sided, so right. Okay, then unilateral because one side, then cleft palate, L is small, so lip. Okay, sorry, lip. Now S is bigger, so complete. What S stands for is soft palate. What is it ending with H? So it is extending till hard palate. Okay. Now coming on to the diagnosis. For diagnosis, what we do is we do a prenatal ultrasound. Now it starts appearing in the 18th week of gestation. This is very important. You must remember this. Then we do prenatal counseling of the parents. Then there is color Doppler ultrasonography.